Good morning, South Africa. This is Johan Rousseau, the chairman of FIRA. We've noted media reports whereby the Minister of Health and others, with the exception of Donald Trump, supports the World Health Organization. FIRA as an organization could not support the World Health Organization in terms of the funeral industry. The funeral industry has no standards, not in South Africa, not in Africa, not in the world, guided by the World Health Organization. There is no standards within the World Health Organization that impacts on each and every country. If there was a standard in terms of the World Health Organization, the spreading of disease could be minimized. We've seen what happens throughout the world with the coronavirus. We understand that health and medical facilities wants to prevent the spreading of disease, but we need to take into consideration, after the person has passed away, what happens then? How is the body removed? By who is it removed? Let's look at the infrastructure of a funeral parlor or a government mortuary or a hospital mortuary. It is not up to the standards which FIRA has set for its own members. And they will be guided through the process to become fully compliant so that we can set not only a national but an international standard in accordance to the ISO 9000, 9001 and thereafter, that has to be set in place because it does not exist. So we just further want to highlight or question the Department of Health. Since they've appointed a panel of experts and invited them, where was the funeral industry experts included into the process? Because they do not know the effect of the diseases being spread from the time of death to the actual burial or the cremation. There is no standards in place. There is no standard operating procedures in place. And we need to stress this, that should mass burials take place, what type of coffins are they going to use? Or are they just going to wrap them in body bags, of which there's no standards as well? We need to look at how is our underground water systems going to be affected, because the coffin's bottom is being made out of pressboard. 70% of a deceased person contains 70% fluids, which is most probably highly infected. We need to request government, what standard sanitizers do they have in mortuaries? What standard gloves do they have? What standard plastic do they utilize in coffins for the lining? What standard body bags are they utilizing? And how is the deceased disposed? To ask the World Health Organization, and we need to ask that to the expert team that was appointed by the Minister of Health. As a matter of fact, they only sent out the invitation for organizations or the funeral industry or any expert to participate after the release of their presentation. And we placed this in front of Professor Karim, which is heading this process in conjunction with others within the experienced team that has been appointed by the Minister of Health. But we are challenging them to involve the funeral industry and people that knows what is the effect and the effect that it has on the public and the effect that it has on our economy. Unfortunately, we once again need to ask is the millions and billions of rands that's been located or allocated to the World Health Organization being spent? We are made to believe that certain organizations in South Africa, funeral associations, has received thousands and allegedly almost 5 million rand to promote their business or to promote their organization. We just ask whether this is fair, whether this is objective, and whether it's going to assist the funeral industry. And parties in the best hotels is not going to stop the process. We need people to be educated, to be supported, and guided by standard laws, which does not exist. Not here. It is not being guided by the World Health Organization, of which South Africa is a co-signatory. We need to get ourselves in a situation whereby we, as the industry, insist on becoming participants in the law-making decisions of South Africa, Africa, and the world. FIRA has written emails a substantial time ago to the United Nations as well as to the World Health Organization. And guess what? They've never responded. So we place this in front of the World Health Organization and people and institutions and governments that did not want to listen. They need to be held responsible for each and every death throughout the world if it relates to a funeral parlor which is not being guided, which is not supported, which carries the best interest of the people at heart. We urge government and the World Health Organization to get a wake-up call and involve people that's done their homework, people which has got people that's got the research, because even within the World Health Organization and South Africa, there is no research available for the funeral industry, except the research that we've done in-house, which consists of almost 600 pages, looking at international standards and the gaps and challenges that exist within current legislation, whether it's good or whether it's bad. We included it. And we've set a standard operating procedure for ourselves, which guides our members and will guide the industry when they become a affiliated member. And we urge international organizations and federations and associations to engage with us, because this is not about a funeral association. Once again, it is all about saving people's lives, including that of employers and employees, inspectors working within government, which has got no standards. Let's ask ourselves, where is the ISO standards for the funeral industry throughout the world? Because it does not exist. And we urge government, through the Minister of Health, to engage with us. We're quite prepared to assist and avail ourselves, as we've stated on a number of occasions. You people need to understand that politics is not going to save lives. It's putting systems and control measures in place that is going to help everyone. Wearing a EFF or a DA or an ANC mask is not going to save lives when a person has passed away of a dreadful disease. He's going to be buried and he's going to be infecting people. And we need to stress the importance from the time that a person passes away until the time that a person is being buried or cremated. We urge government to get a wake-up call, because you will be held responsible and solely responsible should any person pass away or contract a disease at a funeral parlor or a government mortuary. Thank you very much. Enjoy your day.